Before you take magnesium tonight for sleep, leg cramps, anxiety, constipation, or muscle weakness, stop for just a moment. Because magnesium can help one person feel calmer, sleep better, and reduce cramps. But in another person, especially after 60, the same supplement can become dangerous. It can drop blood pressure too low. It can interact with medications. It can build up in the body if the kidneys are weak. And in serious cases, too much magnesium can affect breathing, heart rhythm, and muscle strength. So the real question is not simply, is magnesium good? The real question is magnesium good for you? Should you take it? Should you avoid it? Or should you only use it after your doctor checks your kidneys, blood pressure, heart rhythm, and medications? I am Dr. Arthur Mark, and in this video, I am going to explain 10 warning signs about magnesium. First, I will show you 5 signs that may mean your body needs more magnesium. Then I will show you 5 signs that mean you should never take magnesium casually, and you must speak with your doctor first. Because after 60, supplements are not toys. They can help, but they can also harm when they are taken at the wrong dose, with the wrong medication, or by the wrong person. Before I begin, leave me a comment below and write one word. Take, if you are thinking about taking magnesium, or avoid if you are worried magnesium may not be safe for you. Also write why you are considering it: cramps, sleep, stress, constipation, diabetes, blood pressure, or energy. I read those comments, and they help me know what senior health topics to explain next. Now let us start with the first warning sign that you may need more magnesium. Warning sign number 1: night leg cramps, muscle twitching, and tingling. Have you ever been lying in bed, just about to fall asleep, when suddenly your calf muscle tightens like a rope? Or maybe your eyelid keeps twitching, or your feet feel jumpy, or you feel tingling in your hands and feet. Many people ignore this and say, it is just age. But sometimes, these symptoms can be connected to low magnesium. Magnesium helps nerves and muscles communicate properly. Think of magnesium like a calming signal for the nervous system. When magnesium is low, nerves may become more excitable. Muscles may contract too easily. That can show up as cramps, twitching, spasms, tightness, or that restless feeling in the legs. Now, I want to be careful here. Not every leg cramp means magnesium deficiency. Leg cramps can also come from dehydration, poor circulation, nerve damage, diabetes, low potassium, certain medications, or overuse of muscles. But if your cramps are happening often, especially at night, and your diet is low in magnesium-rich foods, magnesium may be one piece of the puzzle. Foods like pumpkin seeds, almonds, spinach, beans, whole grains, and dark leafy greens contain magnesium. But if you have kidney disease, diabetes, kidney issues, or potassium restrictions, ask your doctor or dietitian before increasing some of these foods. The key is not to guess. The key is to notice the pattern. If you have cramps, twitching, tingling, or restless legs, comment cramps below. Warning sign number 2: poor sleep, racing thoughts, and stress that will not calm down. Many people take magnesium because they hear it helps sleep, and for some people, it may help relaxation. Magnesium is involved in nerve signaling, muscle relaxation, and stress response. When your body is under constant stress, it may use and lose more magnesium. Stress hormones can make the body work harder, sleep becomes lighter, and the nervous system stays alert even when you are exhausted. This creates a cycle. Stress can lower magnesium. Low magnesium may make the nervous system feel more tense. Then sleep gets worse. Then stress gets worse. Then the body feels even more drained. That is why some people feel like their mind is tired, but still cannot switch off at night. They lie in bed with racing thoughts. They wake up at 2 or 3 a.m. They feel anxious for no clear reason. They get irritated faster than before, and they start looking for something to calm the body down. Magnesium may help some people in this situation, especially if they are not getting enough from food. But do not think of magnesium as a sleeping pill. It is not magic. If your sleep problem is caused by sleep apnea, pain, frequent urination, uncontrolled blood sugar, depression, anxiety disorder, caffeine, alcohol, or medications, magnesium alone will not fix the root problem. So if you are taking magnesium for sleep, ask yourself, am I also fixing the habits that damage sleep? Am I drinking caffeine late? Am I eating heavy meals before bed? Am I waking up to urinate because of diabetes or prostate issues? Am I taking medications that affect sleep? Supplements should support a plan. They should not replace a plan. If sleep or stress is your reason, comment sleep below. Warning sign number 3. Muscle weakness, low energy, and fatigue. Magnesium is involved in energy production. Your muscles need magnesium to use energy properly. So when magnesium is low, some people feel weak, tired, heavy, or drained. They may say, "My legs feel weaker. I get tired faster. I do not have the strength I used to have. I feel exhausted even after resting." Again, fatigue can come from many causes: anemia, thyroid problems, heart disease, low vitamin D, poor sleep, diabetes, kidney disease, infection, depression, and medication side effects. So we should not blame everything on magnesium. But if you have low energy, together with muscle cramps, poor sleep, and a poor diet, magnesium becomes worth discussing with your doctor. This is especially true if you eat very few whole foods. Many people over 60 eat less than they used to. Appetite goes down. Chewing becomes harder. Digestion changes. Some people avoid nuts, seeds, beans, and greens. Others rely on bread, tea, biscuits, rice, processed foods, and quick meals. That kind of diet may not provide enough magnesium. And when the diet is low for months or years, the body begins to show signs. This does not mean you should immediately buy a high-dose supplement. It means you should first look at your food, your medicines, your kidneys, and your overall health. Sometimes the best first step is not a pill. It is a better meal pattern. Warning sign number 4. Diabetes, insulin resistance, and blood sugar problems. If you have type 2 diabetes, prediabetes, or insulin resistance, magnesium becomes especially important. Magnesium helps the body use insulin properly. Insulin is the hormone that moves sugar from the blood into the cells. When magnesium is low, blood sugar control may become more difficult in some people. Also, when blood sugar stays high, the kidneys try to remove extra glucose through urine. Along with that, the body may lose more minerals, including magnesium. So diabetes can increase magnesium loss, and low magnesium may make blood sugar control harder. That is another cycle. But here is the warning. If you have diabetic kidney disease, low eGFR, high creatinine, or chronic kidney disease, do not take magnesium casually. Why? Because your kidneys help remove excess magnesium. If the kidneys are weak, magnesium may build up in the blood. So diabetes is a reason magnesium may matter. But kidney disease is a reason magnesium can become dangerous. That is why seniors with diabetes need a smarter approach. Ask your doctor, what is my eGFR? Is my kidney function safe for magnesium? Could magnesium interact with my diabetes or blood pressure medicines? Do I need magnesium from food, or is a supplement safe for me? That is the right way. If you have diabetes or blood sugar concerns, comment diabetes below. Warning sign number 5. Older age, water pills, acid reflux medicine, alcohol, or heavy sweating. This group is very important. Many people over 60 are at higher risk of low magnesium because of several reasons happening together. First, absorption may not be as strong as before. Second, appetite may be lower. Third, the diet may contain fewer magnesium-rich foods. Fourth, some medications may affect magnesium levels. Water pills, also called diuretics, are used for blood pressure, swelling, and heart problems. Some diuretics can increase mineral loss through urine. Acid reflux medicines, especially proton pump inhibitors like omeprazole, lansoprazole, or similar drugs, may be linked with low magnesium when used long-term in some people. Alcohol can also increase magnesium loss, and people who sweat a lot, exercise heavily, or work in hot environments can lose minerals through sweat. So if you are over 60 and you take water pills, acid reflux pills, drink alcohol regularly, sweat heavily, or eat a low-mineral diet, magnesium may be worth discussing. But again, do not guess, because the same person who may be low in magnesium may also have kidney disease, low blood pressure, heart rhythm problems, or medication interactions. That is why the safest question is, do I need magnesium, and is it safe for my body? Before we move to the 5 reasons you should avoid magnesium, do me a quick favor. If this video is helping you understand supplements more safely, like the video and subscribe to Dr. Arthur Mark, and comment your main reason for magnesium: cramps, sleep, stress, diabetes, blood pressure, constipation, or medication. Your comment helps me know which magnesium topic to explain next. Now let us talk about the dangerous side, because this is where many people make mistakes. Warning sign number 6, kidney disease, high creatinine, or low eGFR. This is the biggest danger. If your kidneys are healthy, they help remove extra magnesium from the body. But if your kidneys are weak, magnesium can build up. This can lead to high magnesium levels, also called hypermagnesemia. Early signs can include nausea, vomiting, diarrhea, and unusual tiredness. As levels rise, a person may develop muscle weakness, low blood pressure, slow reflexes, confusion, trouble breathing, irregular heartbeat, and in severe cases, serious heart complications. This is why anyone with kidney disease must be careful. If you have high creatinine, low eGFR, chronic kidney disease, diabetic kidney disease, kidney failure, or you are on dialysis, do not take magnesium supplements unless your doctor or nephrologist tells you it is safe, and be careful with magnesium-containing laxatives or antacids too. Many people do not realize those can contain magnesium. A senior may say, "I am not taking magnesium as a supplement," but then they are taking a constipation powder, antacid, or sleep supplement that contains magnesium. Always read the label, and if your kidney function is not normal, ask first. This is not fear, this is safety. Warning sign number 7, low blood pressure, dizziness, or fainting. Magnesium can relax blood vessels. For some people with high blood pressure, that may be one reason magnesium is discussed. But if your blood pressure is already low, magnesium may push it lower. And after 60, low blood pressure is not a small thing. It can cause dizziness. It can cause fainting. It can increase fall risk. And falls in seniors can lead to hip fractures, head injuries, hospital stays, and loss of independence. So if you already feel dizzy when standing, if your blood pressure runs low, if you have fainted before, if you take blood pressure medications, or if your doctor has told you to be careful with low pressure, do not start magnesium without asking. Also, if you take magnesium and suddenly feel lightheaded, weak, sweaty, faint, or unusually tired, check your blood pressure and contact your healthcare provider. Do not ignore dizziness. Your body may be telling you the dose, timing, or supplement is not right for you. Warning sign number 8, slow heart rate or heart rhythm problems. Magnesium affects muscle and nerve activity. That includes the electrical system of the heart. Now, magnesium is sometimes used medically in hospitals for certain rhythm problems, but that is under careful supervision. That does not mean everyone with a heart condition should take magnesium at home. If you have a slow heart rate, heart block, irregular heartbeat, a pacemaker, heart failure, or you take heart rhythm medicines. You must be careful. Too much magnesium may slow signals in the body and may create problems in people who already have heart rhythm issues. This is especially important if you are older and taking multiple medications. The heart is not something to experiment with. If you are taking magnesium and notice unusual weakness, slow pulse, faintness, shortness of breath, chest discomfort, or irregular heartbeat, do not treat it like a normal side effect. Get medical help. Supplements can affect the body. Natural does not mean harmless. Warning sign number 9. Medication interactions. This is one of the most common mistakes. Magnesium can interfere with certain medications, especially by binding to them in the stomach and reducing absorption. This can make the medication work less effectively. Some antibiotics, such as tetracycline type or fluoroquinolone type antibiotics, may not absorb properly if taken too close to magnesium. Some osteoporosis medicines, called bisphosphonates, may also need separation from minerals like magnesium. Some thyroid medicines may need careful timing away from minerals. Certain heart medicines, muscle relaxers, blood pressure medicines, water pills, and acid reflux medicines may also require caution. The exact answer depends on the medicine. That is why your pharmacist is so important. Before taking magnesium, take a picture of your supplement bottle and ask your pharmacist, "Can I take this with my medications? What time should I take it? How many hours should I separate it from antibiotics, thyroid medicine, bone medicine, or heart medicine?" This one question can prevent a serious mistake, because the danger is not always that magnesium poisons you. Sometimes the danger is that magnesium blocks the medicine you actually need. Imagine taking antibiotics for an infection, but the magnesium prevents proper absorption, or taking bone medicine, but minerals reduce its effect, or having a heart medicine that needs careful stability, but supplement timing makes things unpredictable. This is why seniors should not take supplements in the dark. Bring everything into the light. Your doctor should know. Your pharmacist should know. And you should know why you are taking it. Warning sign number 10. Diarrhea, nausea, weakness, or taking multiple magnesium products. This is a sign many people ignore. They take magnesium, get diarrhea, and say, "Maybe it is cleaning me out." No. Sometimes diarrhea is your body saying the dose is too high or the form is not right for you. Magnesium citrate and magnesium oxide can loosen the bowels more. Some people use them for constipation, but if used too much, they can cause diarrhea, dehydration, electrolyte imbalance, and weakness. This becomes more risky after 60, because dehydration can affect blood pressure, kidneys, balance, and energy. If you take magnesium and develop diarrhea, nausea, stomach cramps, unusual weakness, sleepiness, low blood pressure, confusion, slow breathing, or irregular heartbeat, stop guessing and get medical advice. Also check whether you are taking magnesium from more than one source. One bottle may be magnesium glycinate. Another sleep supplement may contain magnesium. A constipation product may contain magnesium. An antacid may contain magnesium. A multivitamin may contain magnesium. Together, the total may be more than you realize. Read labels carefully. And remember, the supplement limit is not only about the bottle in your hand, it is about the total amount from all supplements and medicines. Now let us talk about how to take magnesium safely if it is appropriate for you. First, check the label for elemental magnesium. This is the actual amount of magnesium your body is getting. Do not just look at the total compound name. Second, start low. Many people do better starting around 100 milligrams with food, often in the evening. If tolerated, some may increase gradually, but do not exceed the safe supplemental limit unless a healthcare professional is guiding you. Third, choose the form based on your goal. Magnesium glycinate is often gentler on the stomach and commonly used for relaxation or sleep support. Magnesium malate is often used by people focused on energy or muscle function. Magnesium citrate may help constipation but can cause loose stool. Magnesium oxide is commonly available, but it is often less absorbable and more likely to act like a laxative. Fourth, do not take magnesium at the same time as certain medicines without checking. Your pharmacist can tell you the right spacing. Sometimes 2 hours is enough. Sometimes 4 hours is safer. It depends on the medication. Fifth, do not use magnesium to cover up symptoms that need a diagnosis. Leg cramps could be circulation. Poor sleep could be sleep apnea. Fatigue could be anemia. Tingling could be neuropathy. Constipation could be medication side effects, low thyroid, dehydration, or bowel issues. Magnesium may help some people, but it should not hide a real problem. Now let me give you the simple Dr. Arthur Mark magnesium checklist. Before taking magnesium, ask yourself 5 questions. Question 1. Do I know my kidney function? If you do not know your eGFR or creatinine and you are over 60 or diabetic, ask your doctor. Question 2. Is my blood pressure low? If yes, be careful. Question 3. Do I have a slow heart rate or rhythm problem? If yes, ask first. Question 4. Am I taking antibiotics, thyroid medicine, osteoporosis medicine, heart medicine, blood pressure medicine, water pills, or acid reflux medicine? If yes, ask your pharmacist about timing and safety. Question 5. Why am I taking magnesium? Cramps, sleep, stress, constipation, blood pressure, diabetes, energy? If you do not know the reason, do not take it just because the internet said it is good. A supplement should have a purpose. Now let us recap the 10 warning signs. The first 5 signs may mean your body needs more magnesium. Number 1. Night leg cramps, twitching, tingling, or restless muscles. Number 2. Poor sleep, racing thoughts, stress, or anxiety. Number 3. Muscle weakness, fatigue, or low energy. Number 4. Diabetes, insulin resistance, or blood sugar problems. Number 5. Older age, water pills, acid reflux medicine, alcohol, sweating, or low magnesium foods. Now the 5 signs that mean you should avoid magnesium unless your doctor approves. Number 6. Kidney disease, high creatinine, or low eGFR. Number 7. Low blood pressure, dizziness, or fainting. Number 8. Slow heart rate, heart rhythm problems, or serious heart disease. Number 9. Medications that can interact with magnesium. Number 10. Diarrhea, nausea, weakness, or already taking magnesium from multiple products. This is the real message. Magnesium is not good or bad for everyone. It depends on the person. The same magnesium glycinate bottle that helps one senior sleep may be risky for another senior with kidney disease, low blood pressure, or medication interactions. So do not ask only, is magnesium healthy? Ask, is magnesium safe for me? That question can protect you. Before you leave, comment your age and what you are thinking about taking magnesium for. Write, age 66, cramps. Age 72, sleep. Age 80, constipation. Diabetes, kidney, blood pressure. Or just write, take or avoid. Your comment may help someone else feel less confused, and it helps me know what topic to explain next. If this video helped you, like it, subscribe to Dr. Arthur Mark, and share it with someone who is taking magnesium or thinking about buying magnesium glycinate. And remember this, supplements should support your health. They should not put you in danger. Do not take magnesium blindly. Know your kidneys, know your medications, know your blood pressure, know your reason. And before taking magnesium, make sure it is helping your body, not harming it.